Hello and welcome. Today we're diving into the complexities of type 1 diabetes mellitus, a chronic autoimmune condition that significantly impacts the nervous system and overall health. The primary cause of type 1 diabetes is an autoimmune reaction. This means the body's own immune system mistakenly attacks and destroys the insulin, producing beta cells in the pancreas. Why this happens is still under investigation, but both genetic predisposition and environmental factors, such as viral infections, are believed to play a crucial role in triggering the autoimmune response. Essentially, the body wages war against itself, leaving it unable to produce the insulin it needs. Let's break down the pathophysiology. Insulin acts like a key, unlocking cells to allow glucose, a type of sugar from the food we eat, to enter and be used for energy. In type 1 diabetes, the destruction of beta cells results in an absolute deficiency of insulin. Without insulin, glucose builds up in the bloodstream, leading to hyperglycemia, high blood sugar. This excess glucose can't be used by cells for energy, leading to cellular starvation. Furthermore, the body starts breaking down fat and muscle for energy, which leads to the production of ketones, acidic byproducts that can become dangerously high, a condition called diabetic ketoacidosis, or DKA. Chronically elevated blood sugar levels also damage blood vessels and nerves throughout the body, contributing to long-term complications. Type 1 diabetes affects people worldwide, but there are some interesting patterns. While it can occur at any age, it's most commonly diagnosed in children and young adults, hence the older term juvenile diabetes. Incidence rates vary geographically, with some countries having significantly higher rates than others. Interestingly, there may be slight variations based on ethnicity as well. Ongoing research continues to map the prevalence and incidence of type 1 diabetes to better understand its distribution. The signs and symptoms of type 1 diabetes can develop rapidly, often over a period of weeks or even days. Common symptoms include excessive thirst, polydipsia, frequent urination, polyuria, often at night, nocturia, unexplained weight loss despite increased appetite, increased hunger, polyphagia, fatigue, blurred vision, and slow healing sores. In some cases, the first sign might be diabetic ketoacidosis (DK), a life-threatening condition characterized by nausea, vomiting, abdominal pain, rapid breathing, and a fruity, smelling breath. Diagnosing type 1 diabetes typically involves several blood tests. A fasting plasma glucose test measures blood sugar after an overnight fast. A random plasma glucose test measures blood sugar at any time of day. An AC test provides an average of blood sugar levels over the past 2-3 months. If these tests indicate high blood sugar, further tests may be performed to confirm the diagnosis and differentiate type 1 from other types of diabetes. These might include testing for autoantibodies, which are indicators of the autoimmune process attacking the beta cells. C-peptide levels can also be measured to assess the pancreas's ability to produce insulin. Type 1 diabetes is not further classified beyond its designation as an autoimmune disorder. There are no different types of type 1 diabetes beyond the singular autoimmune etiology. The cornerstone of treatment for type 1 diabetes is insulin therapy. Because the body doesn't produce insulin, it must be replaced through injections or an insulin pump. Multiple daily injections or continuous subcutaneous insulin infusion via pump are necessary to mimic the body's natural insulin release. Blood glucose monitoring is crucial, often multiple times per day, to adjust insulin dosages based on food intake, activity levels, and other factors. A healthy diet, regular exercise, and education about diabetes management are also essential components of a comprehensive treatment plan. Continuous glucose monitoring at CGM devices are increasingly being used to provide real-time blood glucose readings, improving glycemic control and reducing the risk of hypoglycemia. Currently, there is no known way to definitively prevent type 1 diabetes. However, research is ongoing to identify potential strategies for preventing or delaying the onset of the disease in individuals at high risk, such as those with a family history of type 1 diabetes. Clinical trials are exploring interventions such as immunotherapy to protect beta cells from autoimmune destruction. While prevention remains a challenge, early detection and management of risk factors may play a role in slowing disease progression. The prognosis for individuals with type 1 diabetes has improved significantly over the years thanks to advancements in insulin therapy, glucose monitoring, and diabetes education. With diligent management, people with type 1 diabetes can live long and healthy lives. However, poorly controlled blood sugar levels can lead to serious long-term complications, including cardiovascular disease, nerve damage, neuropathy, kidney disease, nephropathy, eye damage, retinopathy, and foot problems. Recent research is focused on developing new and improved insulin delivery systems, such as closed-loop systems at artificial pancreas that automatically adjust insulin dosages based on real-time glucose levels. Immunotherapies aimed at preserving beta cell function are also showing promise in clinical trials. Ultimately, the goal is to find a cure for type 1 diabetes and prevent the autoimmune destruction of beta cells.